Shona.
There, hi.
Okay, I think we should start. Beth, do you?
Yeah,
Okay.
absolutely.
Very good. So welcome everyone to today's Reverse Ret Bite-Size session. These sessions are being brought to you by a new project of Reverse Ret called Ret Connect, which is being funded by the Pears Foundation. And as always, we have a half an hour session and then followed by question and answers. If you do have any questions, you can pop them into the chat box and we can ask them afterwards, or you can raise your hand if Gail's happy to take questions during the presentation.
That's fine. If someone would alert me when that's happening, that's fine.
So Beth will do that. You can put your real hand up or your virtual hand up. Somebody will be looking. So people with learning disabilities are a lot more likely, in fact, 10 times more likely to have problems with their eyes, their eyesight than the general population. And they're also a lot less likely to be attending the optometrist regularly or to be provided with glasses than everyone else. And there's lots of reasons for this. One being that it's so difficult, as we all know, to do these kind of exams on people with Rett syndrome. So our presenter today believes strongly that not being able to speak, or indeed having any of the issues that people with Rett syndrome have, none of them should be a barrier to good eye care. Gail Gordon, Dr. Gail Gordon, is a senior lecturer in optometry at Glasgow Caledonian University and has been working for a number of years as the lead for the Learning Disability Clinic at the university's Vision Centre. I've known Gail now for, it's got to be 12 years. First met you at an Edinburgh conference on Rett syndrome research, which was actually an amazing gathering of people, but it was a wonderful place to meet you and Gunter. Because Gail is also the proud mother of a 15-year-old daughter with Rett syndrome. If you do have questions, I should also say, please can you just keep yourself on mute till you ask the question so that the sound is good throughout the session. We will be recording. So if you don't want to be on the camera, switch camera off. Gail, welcome. Thank you for being here and over to you.
Right, I'll just see if I can share my screen. That's always the first challenge, isn't it? Right.
I had to watch a YouTube video on how to do that, and I have to do it every time. Good, you've done it. Well done.
So you can see it. That's good news. Right. There we go. So you can all see my screen. Can you hear me okay? Okay. So so as Rachel said, this was my first slide. I was going to tell you who I was, but I think we can skip over that, which is good. But yeah, I've been an optometrist for nearly 30 years now, and I have been working at Glasgow Caledonian for quite a lot of those years. And for about the last 10 years, I've been working in the specialist clinic that we have for learning disability at Glasgow. And I took over from who was the lady who was my pre-reg supervisor, PhD supervisor. And the people who have older girls with Rett syndrome might be interested to know that the reason this clinic was set up in Glasgow was because a certain clinician called Dr. Alison Kerr was looking for vision care for people with for people with complex disabilities after the institutions closed. So people that were now in community care were no longer getting their eyes tested. So Dr. Alison Kerr, for people who have younger girls, was once the main person for Rett syndrome in the UK until retirement, in fact. And so she will actually make an appearance later on in this talk because she's done quite an important study in vision in Rett. So my plan for this morning is to sort of divide it into two parts. I'm going to talk first about vision in Rett syndrome generally. And then, because as Rachel said, it can be quite difficult to approach an eye examination to get your eyes tested if you do have very complex disabilities. And so there's just one or two things that I want to say to try and help you with that, and a few things that I want to do to try and encourage you to get glasses and to help the person that you care for wear those glasses. So just going to start with vision in Rett syndrome, and I'm going to start with a spoiler. Because if, like me, you sometimes stop listening about halfway through, I'm going to give you the good news now. So it is good news. People with Rett syndrome seem to have very good vision. And this is surprising because, as Rachel was saying, people with learning disabilities generally tend to have poorer vision than the general population, but people with Rett syndrome seem to have really good vision. So this is excellent news. However, big however, it's nevertheless extremely important to have regular eyes tests and wear spectacles if they're prescribed. So it's good news. And it's good news because vision is so utterly essential to our experience as humans. Good eye care or good eyesight. Sorry, I'm just going to move this because I've got a little thing here and I can't see my slides. I can see myself, which is a bit, there we go. So how important is good eyesight? And it's absolutely crucial to our development. Our first experience, our first way that we interact with the world after we're born is through our eyes. Long before we can reach out and touch things, we're looking at things. It's known that infants from the very, very early stages are able to recognise their own parent's face, usually mum, and respond differently to mum's face than to other faces, even when they're presented as pictures. It's not just mum, but it's mum's face in particular. So it's not the smell of mum, it's mum. They're looking at mum, they're recognising mum. And we are able to start exploring our world. We start to interact with people and communicate with people. We return a silent smile from about 6 weeks of age. And it's known, therefore, that children who have poor vision have poor general development. So children that have very severe visual impairment tend not to develop along the normal timescale, very often diagnosed at a later stage with a social communication disorder like autism, and the general quality of life for people in general. But I think arguably for people with Rett syndrome in particular, it's essential to be able to see, because this is how we're interacting with our world. If you've got Rett syndrome, you can't reach out, you can't touch, you may not be able to talk, you may have difficulties expressing yourself, will have difficulties expressing yourself, even if you've got an eye gaze. The way that we interact, the way that they interact is through our eyes and how well they see. So that being said, and as Rachel intimated, unfortunately, people with disabilities are actually far, far less likely to have a regular eye exam than people without. And this is a real shame, because most of the vision problems that people have with complex, profound disability, most of these problems are actually treatable. So they can be treatable by spectacles. If you don't have spectacles, if you're very short-sighted, you'll know how difficult it is to get around. It's very disabling not to have your spectacles. We can manage squints. Cataracts are more common, and in a younger age in people with disability, cataracts are treatable, cataracts can be removed. So most of these problems that people have are treatable. So we need to be getting people into their optometrist to get their eyes tested. And unfortunately, far, far less likely to be having regular eye examinations. So that was people with learning disability in general. Let's talk more generally, more specifically about people with Rett syndrome. So this is my daughter Romy. She will be making an appearance throughout this talk, and she has given permission for me to be showing her pictures. So just to make that clear, I'm not doing this without her permission, because at 15 you can be a bit fussy about being posted on online by your mother. But no, she's cool with this, so we're going ahead. So there are three different kind of groups of evidence. And in fact, Beth and I were just talking about this beforehand. What is the importance of parental anecdote? And actually it's essential when we're thinking about understanding what people with complex disabilities actually see. So there's evidence for observation from people. There's evidence from research studies of people with Rett syndrome. And finally, specifically evidence from brain imaging. So MRI or CT, looking at the brains and the visual parts of the brains for people with Rett syndrome. So observation. You are no doubt aware that eye contact is a real strength for many people with Rett syndrome. What you might not be aware of is that good vision is essential for good eye contact. So you need to have good vision to be able to make good eye contact. And it's actually quite a useful tool for assessing vision of people, and people who are difficult otherwise to test. And there has been some work that have been done in infants that has been able to demonstrate that if you're able to hold eye contact at 8 meters or return a silent smile, so no noise, no talking, if you're able to maintain eye contact or return a silent smile at 8 meters, then you have a very good standard of vision. So that's roughly equivalent to what you might have heard of as being 20/20. So 20/20 vision. So that's a very good standard of vision. So if someone is able to maintain eye contact across a room, then they've got a good standard of distance vision. And for most of us, I think, and the people that we care for, that is true. And it's enormously reassuring. Some people with Rett syndrome are not able to maintain good eye contact. And it's important to be clear there are reasons other than vision for them to be unable to do that. So poor eye contact does not always mean poor vision in people with disabilities, but certainly if they are able to maintain good eye contact at a distance, then that suggests a good standard of vision. There has been some proper lab research done, and I said I would mention Alison Kerr again. And this study, now this seems quite old, but there's a reason why it's this study, and it's not just because it's Alison Kerr, and it's not just because Daphne McCulloch was my PhD supervisor, and this study was conducted in Glasgow, and in fact I was involved in this study as a research assistant. So unlike most people, I'd actually encountered quite a lot of people with Rett syndrome before I was even a mum, far less before Romy was diagnosed. And so this was a study that was done back in the mid-90s with Alison Kerr, and it was looking at women and girls with Rett syndrome. This is pre-genetics, so at that time it was just thought it was only women and girls. So it's women and girls with Rett syndrome. And what's different about the study, and why this study is still valid, and why this is the study that I am going to talk about, is because it was carried out by optometrists. The first thing that optometrists do is test the eyes, prescribe spectacles, and these girls and women were wearing spectacles when they're having their eyes tested. Now, this is obvious, isn't it? If you need glasses, you put them on and then you get your eyes tested and see how well you can see. But in actual fact, this very, very, very rarely happens. So in a lot of psychology research, because it's psychologists and optometrists that are doing it, it's not something that happens. People aren't given the best correction in order to do the test. So what they did was, this setup probably looks quite familiar to a lot of people because it looks like an EEG. And many of you will have taken your loved ones for an EEG for their to assess whether or not they've got epilepsy. The EEG is a bit of a messy kind of waveform. There's lots of spikes and waves. There's lots of noise all over the place. But within all that noise, each little spike, each little wave represents something that's going on in the brain. Now, what you can do, and here what you can see is that the electrodes, can you see my cursor? So the electrodes are here over the back of the head, and that's the visual part of the brain. And what we can do is we can record particularly from the visual part of the brain. And this person here is looking at black and white squares, very simple target. And these black and white squares are going to flip between white and black and white and black and white and black at about that kind of pace. And what eventually starts to happen, if you average all the waves that you get from the brain, is that you get a very typical wave shape like this one here on the bottom right of my screen. So you can see what here's marked some N70. Oh dear, didn't mean to do that. It was a Mac and I'm used to using a PC now, and it just clicked forward one button. So anyway, you can see that there's a trough here and there's a nice big peak here, and this is a very typical waveform. This is the sort of thing that you will get, and that indicates that somebody has seen those squares. If the vision's not good, then these waves might be a little bit flatter, or this P100 indicates that what's happening is about 100 milliseconds after the squares have been shown. If this peak appears a little bit later, or if it's a little bit flatter, then someone's not seeing so well. And you can actually use this to determine exactly how well someone sees. Now, what's my colleagues found is something that they really did not expect. And that was that the people that were testing had good vision. So in contrast to all the other groups of people with complex disabilities that they had tested up until that point, people with Rett syndrome had good vision. But they did find that the need for spectacles was greater in this group than in controls. And it wasn't just that they had a little spectacle prescription, they had some of them quite strong spectacles. They needed quite strong spectacles. So in order to see well, they needed to be provided with spectacles. They found quite a number of squints. And really the conclusion was that people with Rett syndrome can see well, but they do need to get their eyes tested so that they'll be provided with glasses so that they're getting the best possible vision. And as I mentioned previously, one of the problems is that this very often doesn't happen. So there was a study that was just published this year, big study, multi-center study, all the big labs in America looking at the same measure of vision, and they suggested that vision was poorer. They found that that waveform was a bit flatter, and the suggestion was that this could be used to assess any treatments and potential treatments in Rett syndrome. But my concern is about that study is that there was no mention of spectacles. And I would suggest that if there was no mention of spectacles, they weren't tested for spectacles, they possibly didn't have the best correction. So they were really relying on people having the spectacles, bringing them with them, wearing them if they needed. And I think we have to take that with a little bit of pinch of salt, and I would be reassured from the earlier study that probably vision is good. On the way past, we're moving out of the early sort of stages of vision, and on the way past, I just want to briefly mention a study from Jill Townend, which her name will be very familiar to you because she works with Rett UK. She was looking at eye movements in Rett syndrome, and a large group of 18 girls and women. That's quite a lot for Rett syndrome because it is quite a rare disorder. They found it hard, which will come as no surprise, but generally speaking, the conclusion was that eye movements are probably within the normal range. And that's very good news for people who are using eye gaze. They need to be able to move their eyes across the screen. They need to be able to dwell on the right points. So it's very good news. Eye movements seem to be normal also in Rett syndrome. Now, I mentioned this slide looked much better on my laptop, so I hope it looks okay for you. As I'm looking at my husband's giant screen, and it looks a bit rubbish, but this is a picture of the brain, and this is the front of the brain, frontal, and the back of the brain. Your eyes are over at the front, but the visual part of the brain actually is here at the back. That's the red bit at the back, the occipital cortex. Vision isn't just about the eyes. Vision is about the processing also in the brain after the information from the eyes passes through the optic nerves and arrives at what we call the occipital cortex, or the vision part of the brain at the back of the head. That information, if you can think of the occipital cortex as being a bit like a post office sorting office, what happens is information about different aspects of vision are then sent off to different parts of the brain. So information, for example, if you're looking at a face, I can see Beth's face in my screen here. I'm looking at Beth's face. I recognize it as a face. My brain will be sending information into the temporal cortex. And within the temporal cortex, there is a special face area, and that will start to process Beth's face and start to tell me, oh, this is someone that I recognize, and I move the information forward, and we start to understand who it is that I'm looking at. The parietal cortex here, this is what we might think of as the where path for vision. So Beth is there at my bottom right-hand bottom right-hand side of my screen. This part of the brain is looking where in my vision Beth is. It's also looking at movement. So I can see people moving in my peripheral vision. Where are these people? It attracts my attention. So this is the where part of the brain. This is important. I'm going to talk about this a little bit more. Anyone that hangs about in the same sort of chat groups and Facebook groups that I do will be familiar with the term CVI, or cerebral visual impairment. It's talked a lot about in the AAC groups, and what cerebral visual impairment is an impairment of vision that cannot be explained by the need for spectacles or disease of the eyes. So the problem is not in the eyes, the problem is somewhere in the brain, in the cerebrum. So it's cerebral visual impairment. The symptoms depend on where in the brain the problem lies, so the location and the extent of any kind of damage in the brain. So some people, for example, following a stroke will have huge bits of brain that have been damaged, and that can lead to a very profound visual impairment. And the bottom point is, this is really, really hard to assess in Rett syndrome. Again, Beth was talking about a questionnaire that she'd received. And what you said, Beth, was that you were asked to say whether or not your daughter could find a blue jumper in a pile of clothes. If you've got Rett syndrome, how is that question relevant? It's very, very difficult. These are very useful questions. They're very specific questions to determining where in the brain a problem lies, but not really suitable for Rett syndrome. So it is very, very hard to assess in the people that we are caring for. So does it exist in Rett syndrome? Well, maybe. An MRI study, a very highly cited MRI study from 2008, did find that the vision area of the brain, and if I just go back, so that's the occipital cortex here, at the back, the vision area of the brain, the main vision area of the brain, appears to be largely preserved. So this is the reason why we seem to have good vision, that we're managing to see the squares okay when we're looking at the computer screen in that experiment. So the vision area of the brain does seem to be largely preserved. If someone has damage to these areas, if there is a problem in these areas, what we tend to see are two things. So we often see a problem with the field of vision and a problem with contrast sensitivity. And contrast sensitivity describes how well we can see things that are in poor contrast, low contrast. I'm going to mention each of these in turn, this very quickly. So this is actually me in my clinic a few years ago. Obviously I haven't changed, but Romy looks a lot older now. And I'm assessing Romy's field of vision here. Now we can't use the tests that you would expect to get in optometrists where you've got the flashing lights across your vision. Actually, now I'm telling a lie, there are labs working on this, but at present, it's not something that we can do. So we are very low tech. Here I've got a comic relief red nose, and that's my standard tool, because a lot of the toys that the optometrists use, I find for adults are a bit patronizing. And so most people find red nose quite entertaining. So that's what I typically use. And what I've done here is I've brought this red nose around from behind Romy, and I hope that you can see that Romy is looking now directly at the red nose, and that's because she's just seen it. Now what you can't see here is I've got a student who's attracting Romy's attention. So Romy was looking straight ahead. The vision. It's a very, very coarse test. I mean, pretty much if I can get my internet unstable, can you still hear me? Yeah. So if we can see the top and bottom, then we're doing well. And really it's the bottom, it's the lower, oh, done it again. It's the lower visual field that we're most concerned about. So lower visual field loss, so that's what you can see below, so below your nose, or depending where it is, somewhere in the bottom half of your visual field is affected. That is very disabling because it can affect your mobility. So if you can't see where your feet are, you can be very unsteady on your feet. It can make it really quite anxiety inducing trying to move about. So that can affect your mobility. So you want to know if somebody with Rett syndrome has a good field top and bottom. In Romy's case, she does, and my gut feeling is, there's not data on, my gut feeling is for the most part, it's going to be relatively normal in people with Rett syndrome. The second thing that I want to talk about, and this is very relevant for anyone that's using communication devices, symbolated communication devices, is contrast sensitivity. And I want to speak to this because it's something that exercises me whenever I'm in these Facebook groups. So I'm going to talk about high contrast and low contrast. What I've got here are just 4 X's. So this is my high contrast image here. So top left, black on white, top right, white on black. Now that's as high contrast as it gets. Black and white is very high contrast. Now it might look that our red and yellow X's are also high contrast, but if we look over to the right here, where I reduce the contrast overall, I think you can see better that the luminance contrast, that's what we call it, so it's not color contrast, it's the brightness of the red is much diminished compared to the other X's there. Does that seem, is that demonstration working for you? So the luminance contrast is much, much lower in this. Why is this relevant? Bear with me. It's relevant because you might have seen these before. So again, if you're in these AAC Facebook pages like I am, there is a big push where there are concerns about CVI, where there are concerns about visual problems in the brain, to push these so-called high contrast symbols. Now what this is high color contrast. It's absolutely not high contrast. And the idea is that for people with cerebral visual impairment, these colors on black will be easier to see. If you look at the low contrast version, so this is to simulate someone who has a contrast sensitivity impairment, what's easiest to see actually are these small red and these small words, yes and no and go and look. And the red X, it's huge, it should be very visible, is much less visible because the contrast is much poorer. So I just wanted to point this out because I am concerned that with the big push for high contrast symbols that we might be doing people we care for a disservice. I would much rather see people use regular symbols, make them a bit larger, use big letters, but I would be very nervous about, unless you're 100% sure that there is no issue with CVI with the person you care for, I would be very nervous about pushing high contrast symbols because they're absolutely not high contrast symbols, they're low contrast symbols. So next bit of the brain, we're moving a wee bit further up, as we might say. And what Carter and the MRI study found was that what's called the posterior dorsal parietal cortex, bit of a mouthful, of the brain is most affected. This part of the brain is part of the where pathway, and it's important for directing movement. People with problems in this area have difficulty reaching for things. Now for you and I, if I see a pen on my desk, I can just move my hand and pick the pen up, and it's an easy task, it's a trivial task. Someone with problems, and I'm not talking about Rett syndrome here, I'm talking more generally, but somebody with problems in this part of the brain will find it very difficult to pick up the pen. They can see the pen, they know where the pen is, but they can't tell their hand where the pen is. And so what will happen, I wonder if I can bring my camera down. No, you can just all see the clutter in this room. No, we'll not do that. What people will do is they tend to reach too far and grasp the pen by pulling backwards. Okay, it's a similar problem with stepping. So it's a similar problem. People will have problems crossing between maybe a carpet and the tiles in the kitchen because they're not sure whether there's a step. It's not to do with 3D vision. It's about telling their feet where it is that they have to move to. So it's visually guided movement. And the second thing that people have a lot of problem with is clutter. So this is what that question that Beth's daughter was being asked about with the blue piece of clothing in a pile of clothes. It helps us to process clutter. If you are struggling with this process, it's called simultanagnosia. So what we're talking about here is this part of the brain. So this is the parietal cortex, this is the where pathway of vision. And simultanagnosia is something like this. If you can imagine this jigsaw puzzle, Most of us, if we're looking at jigsaw puzzle, we could just look at the box, and we can, even though we've got a bunch of jigsaw pieces, we can work out what the final puzzle is going to look like because we can look at the box. Having simultanagnosia is like picking up a single jigsaw piece and then another single jigsaw piece and then another single jigsaw piece, and trying to work out what the whole picture is from looking at these individual jigsaw pieces. So it's an extremely difficult task. And in order to simplify things and to make things easier for people with simultanagnosia, what we need to do is to try and limit clutter. Now, have a look at this. This is a screenshot from my daughter's friend's talker. Now, first to say, my daughter's friend does not have simultanagnosia. She also doesn't have Rett syndrome, and she manages this very, very well. So just to make that clear. But if someone does have simultanagnosia, if someone does have cerebral visual impairment, this is going to be an absolute nightmare to try and navigate. So if we're thinking about how the people that we care for are communicating, we need to think very carefully about how we structure the grids that we're offering them. And I think also I would like to say that sometimes what will happen is if we're moving from a simple grid, so maybe a 3x3 grid where there's only 9 cells, or a 5x5 where there's 25 cells, up to something much more complicated, the reason that someone might not be able to cope with it might not be because they don't have the intelligence to deal with that. It may simply be that their brain can't cope with the complexity, can't cope with the clutter that's involved in this sort of arrangement. So I would avoid high contrast symbols, and I would think very carefully about the grid setup. And I would just be cognizant of the fact that maybe it's not to do with their intellectual ability, and it's just environment. So something that's been set up by Gael Gordon and Jennifer Faccinelli is much less cluttered than this, so that if you look on the Toby Dynabox page set page, it's been specifically set up for Rett syndrome, is much less cluttered than this. There's much less on it, and it might therefore be more suitable. But it's just something to be aware of. So what time am I? Probably running massively over time. Sorry, I'll try and skip through.
Okay, yeah, keep going.
You've got other things to do. So quick summary, people with Rett syndrome, good vision, but they may very well need glasses, and sometimes strong glasses. There's no robust evidence for CVI because it's very, very hard to test for. And a lot of the things that people will ask about, like looking for a jumper in a pile of clothes, is not something that someone that's got no hand use or mobility can actually do. So there is something to be aware of. We do know that that's where that the brain can be affected. So it is something to be aware of. Just anecdotally, I'm pretty sure Romy doesn't have a problem with that, but it is possible that other girls do. So the eye examination, I just wanted to finish up by giving you a few guides, a little bit of guidance, and a few tips to help you with the eye examination and finding an optometrist and getting the best out of the eye examination for the person that you care for. The first tip I have is to ask for recommendation for an optometrist. Now, not every optometrist, like not every GP, is going to have much experience dealing with someone that's as disabled as someone that has Rett syndrome. So my top tip is to ask for recommendations locally. The other, if you can't get a recommendation, the other thing to try is to try the Seeability website. Now, I've given the information for that to Beth, and Beth will share that with you. The Seeability as a charity that's been set up specifically to support people with learning disability access eye care. And they've got a tool on their website that helps you find an optometrist who will have at least the equipment in practice to be able to test the eyes of your the person that you care for. But I would still probably ask for a personal recommendation in the first place. And there are a number of universities like ours, if you live close to Cardiff, Aston, Coleraine, have specialist clinics that are just set up for assessing people with complex disabilities, but there are a number of excellent optometrists out there in the community who would be willing and more than able to complete the eye examination. Something that might be useful for you before you attend the practice is to have a wee pre-visit. So just visit the practice, meet your optometrist, meet the other staff that you might be dealing with, and that could just make the experience a little bit more comfortable. I'm sure you're all familiar with social stories. There's a very good one on the University of Ulster website. And again, I've given the links to the University of Ulster vision resources to Beth, and she'll be able to share them with you. And it just shows the person that you're caring for, what's going to be involved, what sort of things are going to happen, and what they can expect from the optometrist. So just, you know, get a little bit more comfortable with the idea if it's something that helps. Not everybody needs that. A lot of people aren't very keen on lights, in my experience. Lots of people just really not keen on getting lights shone into their eyes. It can be useful just to get a simple pen torch, any kind of torch, explain what's going to happen, explain to your child, look, I'm going to put the light in your eyes, and we're just going to gently flash the light in the eyes and explain this is what's going to happen when they go to the opticians. And just get used to the idea, because it's something that feels a little bit uncomfortable. It's not painful, but it's worth just having a wee practice before you go. Can you test the eyes of someone who can't talk? Well, the answer is yes, usually. The optometrists that will be listed on the Seeability website will all have these cards. So these cards have been developed at the University of Cardiff for testing people's eyes, for children's eyes, toddlers actually. And that's a bit of a problem in my view. Certainly from my own experience, Romy just isn't interested in looking at a fish or a train or whatever. But lots of people are quite keen. I find actually people with Down syndrome are often very keen to get involved with this, and that's great. But yeah, my own daughter, my own experience, not so much. But the principle here is that there's a blank piece at the top and there's an image at the bottom. And the optometrist will look to see whether your child is looking up or looking down. And if they're looking down, then you've seen it. And the clever thing about these cards is if you can't see it, this fish disappears. I mean, it completely disappears. So that if there's nothing there that's visible to your child, they won't show a preference for top or bottom. And they do this multiple times just to be sure. So you can test the eyes. It doesn't require pointing like this little boy's doing. It doesn't require anyone to talk. It's simply eye movements. And as I said, people with Rett syndrome, good eye movements, this should work. So there are a number of tests and instruments that optometrists can use to test people's eyes, but it can be difficult. And sometimes what we're relying on is a careful history. So asking about eye contact, asking about what sort of things can they see. So if the person that you care for is still able to eat orally, and you're coming through from the kitchen and you've got some sweeties or something that they're very keen on, and most people, one of the last things they can eat are still chocolate buttons. So if you're coming through with chocolate buttons, can they see the chocolate buttons? We will ask questions that will give us a good indication. But generally speaking, we can get an assessment of somebody's vision using these sorts of cards. But it does sometimes mean that we need to get people to come back. Just occasionally, we don't get very much information at all from our tests. And the question then is, do we refer someone on to the hospital? My own view is that very often this isn't helpful, because if I can't assess your child's eyes, people in the hospital are going to have exactly the same difficulties. If I've reassured myself from what you've said and when I've said that things are probably okay, then more often than not, I'll just get you back for an early appointment and to check you. So even though I don't see anything, I don't always refer into the hospital. I mean, you guys are having enough appointments without this. For someone with Rett syndrome, if I can't test them, it's probably going to mean a general anaesthetic. And honestly, the fewer general anaesthetics our children have, the better. So very often and it's just a case of watchful waiting, and just see how things are progressing. Will we use eye drops? Honestly, probably. It is possible to assess whether someone needs spectacles without drops. That's most commonly done in the university centres. Not every optometrist on the high street will be comfortable doing this. And sometimes we've got to use drops. So if we suspect that someone has a squint, or if we really want to look in the back of the eye and we just can't see, we're going to have to put drops in. So sometimes, sorry, we're going to have to put drops in. If it's going to be a problem, it's sometimes helpful for the optometrist to give you saline drops to practice with, so that you get used to the idea. Or it can be the case that we can give you the drops away and you can do it at home. Maybe we've got extra carers in, it might be more comfortable. If that's something you think will work for your child, then speak to the optometrist, speak to the practice about it, because that can be done. Do ask your optometrist about the assessment of near focus of accommodation. Now, this can't be done with drops. And so if drops have been used, it'll need an extra appointment. Near vision is essential. Now, this picture of the white rabbit is deliberately out of focus. This is actually a campaign that the College of Optometrists just launched this week, just in time for me to do this assessment. So you need good vision at near if you're going to be able to read. And it's not always assessed in disabled people, but it can be assessed in people with disability. And it needs to be assessed because people with neurodisability are much more likely to struggle to focus at near and may need reading glasses. Now, this is something that Romy does have an issue with. So she can see in the distance really well, but she doesn't focus accurately for near. So what she has is a pair of reading glasses that she wears when she's using her eye gaze. And this is something that we need to do separately, and it cannot be assessed with eye drops. So do speak to your optometrist about that. If you use an eye gaze, it's worthwhile, if you can't bring that eye gaze device into the appointment, to measure the distance between your child and the eye gaze, so that the spectacles, if they need them, can be prescribed for precisely this distance. Be aware that if you do get reading glasses, and those of us that are old enough to wear them and know this firsthand, it does blur distance vision. So it's important to let teachers and carers know if they're reading glasses, because there's no point in putting them on for the telly, there's no point in putting them on if you're going to see Little Mix, because they won't be able to see. These are just for the task, for near, for the eye gaze, or for something that's close at hand. So do let teachers and carers know what the glasses are exactly for. And if your optometrist should provide you with written details about this, and if they don't, just ask and they'll be happy to. Now, I'm saying all that, and I know that a lot of you will be saying, yeah, but my child won't wear glasses. And I know you'll be saying that because that's what I hear a lot from the carers and parents of people that I see, my patients. It's really important to try and persevere with the glasses. There are a couple of things that you can do to make the glasses more comfortable. Make sure that the frame fits well. Never, ever, ever, for your child who has a disability, get the glasses online. You need to get them from the optometrist. They need to be fitted correctly. They need to fit properly over the bridge of the nose. They need to fit comfortably behind the ears, because if they're not comfortable, they're not going to wear them. You wouldn't, I wouldn't. They need to be comfortable. And in that case, also think about the lenses. If they're heavy, not going to want to wear them. If someone has a very strong prescription, it is more expensive to get thinner, lighter lenses. I know it's more expensive, but it might be worth it if they're going to wear the glasses. So it's something to consider. One of the ways that you can make lenses lighter without going for more expensive lenses is to go for a smaller frame. So just if the lenses are too expensive, think about going for a smaller frame. Explain to your person why spectacles are needed. If you just put something on someone's face and they don't know why they're there and what the benefits are, well, they may not wear them. So explain why you're putting the glasses on, and then start to build up the wearing time. So do a motivating activity, something you can do together, some special time together, something that your person really enjoys, maybe it's a favourite story. And if they remove the glasses, the activity will stop. And so this will be something that we'll work on together while we're persevering to get used to the glasses. So it's quite useful to just do something that's a really special time and keep persevering. And when I say persevering, it can sometimes be a few seconds is a win. So seconds, minutes, it's going to take time. But in my own experience, over the last 10 years, if people need glasses, they will wear them. And it's just really more of a case of getting used to the idea of something on the face. Even people with autism, severe autism, and their carer says absolutely no way. If they get benefit from them, of course, you want to wear your glasses. If the prescription's very weak, then whatever, and I wouldn't push it. But if someone has a prescription that they need, do persevere. Right, sorry. So that did take a bit longer than I did rehearse this, and it was 29 minutes, but I seem to have taken longer this time. So, yeah, summary: vision is good. So good, thumbs up, smiley face. Vision is good in Rett syndrome, but you might need glasses, so do wear them. We might have, or people might have cerebral visual impairment, but it's extremely difficult to assess. Just as a last point, I think that the competence with eye gaze grids that a lot of people with Rett syndrome show suggests that it's not a significant problem, and it's not something that we should be necessarily overly worried about. So thank you. That's me. Any questions?
Well, I'd just like to say, I can't believe how interesting that actually was. And there's so many elements of it that have been really valid. Not that I thought it would be boring, but there's, there's so many elements of it that are validating about your overall experience of having a child with Rett syndrome. So for me, for example, I always wondered why when Amber could walk, if the path wasn't clear for her, why it was so difficult. So she used to do this thing where if the floor was cluttered, she would like walk for a few steps and then turn around, and then sometimes she would fall over. But if you cleared it, she could go straight across the room. So that's one. And then the other thing is with her eye gaze, she was always very good once she was on the screen that she was interested in, which were very simplified. But then when it was, the transitioning screen where you're looking at the different categories, she could never get to grips with that. She never has. And so I think just understanding a bit more about how the brain works and with regards to vision has been really helpful. Aside from all of the practical advice about eye tests and so on. So Beth handles questions. Beth, over to you.
Okay. Gosh, I would just echo that, because particularly about moving and stepping, I've always been baffled at why. So Hannah will stop walking and she'll freeze. She'll get really, really stressed. If it's completely clear, but it's just a change in surface, not even level, just as you said, carpet to laminate or grass to
that's very typical.
And that's always baffled me completely. So that was a bit revelationary for me. Thank you.
Can I say that if the person that you care for is still mobile and they're experiencing that kind of problem, something that's useful to do is to try and be quite stiff when you're holding their hand. So that, I wonder if I can show it in my screen, so that when you move, now I'm showing that I hadn't got smart except for the top half. I've still got the jeans on. But if you move up and down, they will feel that. So if you keep your arm quite stiff, and that can be quite helpful for transitioning across thresholds and surfaces, because the problem is not with the movement necessarily, it's on the visually guided. So we've got this extra proprioception, so that the extra touch that's going on will give us input from another sense. And so that can be very helpful if you're crossing boundaries for people.
What can actually be done about, that you mentioned this issue about the low visual field. What can actually be done if you have problems with that? Because it seems to me like my daughter's always had that kind of problem, for, just anecdotally, because of the threshold thing, because the stairs were terrible for her. It was one of the first things that she found difficult, especially down.
There's not really very much that we can offer. So the problem is that when you have Rett syndrome, the compensations that we could suggest are not available to you. So it's the whole of your, possibly your lower vision. So you're just looking through the top, and you could potentially put your chin down and look through the top at the the surface in front of you. But if you've got Rett syndrome, you can't do that. So the adaptations are very limited, and it's really more about being aware of supporting someone, supporting them when they're moving about, rather than us being able to do anything for it.
Okay, yeah,
trying
Gail,
to avoid
I think
clutter, take coffee tables out of the way, things that you might trip over, puppies. Could be a problem.
I was actually just going to say, I think that the important thing about that, though, is that making sure that this issue of the people don't seem to want to walk, they seem to walk and then they're nervous, can be swept aside a bit by explaining this to people, that
Yes,
there are reasons why it's difficult to walk when things aren't clear.
So in a way, it's an environmental factor. What you can do is environmental rather than.
Yes. So we'd suggest tidy, be a tidy freak. Have the furniture up against the walls. No pattern flooring. Patterned bedding is a problem. So you want everything just so, little kids, they often have, I don't know, what's that, pets? Oh, anyway, something from Nickelodeon. And Dr. McStuffit or whatever it is on their bedding. What you want is to have everything to be just plain. You need their environment to be as plain as possible, everything to be as uncluttered as possible. Avoid pattern in the environment. In schools, you really want to encourage them to take everything off the walls. That's hard to do because teachers really like to show what's going on in their class, but really, and especially in special schools where CVI is very common, the walls should be completely clear. And CVI is very common mainly because of children who are preterm, born very early. So it's very common in these children. And so it's something that's becoming increasingly common as these children survive into childhood and adulthood. So everything should come off the walls. I mean, the state of Gunter's office, disaster. It really needs to be made, feng shui, very, very stripped down and bare. And that's the perfect environment for somebody that's got CVI.
So I wanted to ask a question. So how could you tell if your daughter had this? Obviously, Emily's very mobile, and so she walks around constantly. Most of the time she's walking, and well, we've got clutter everywhere actually. Our house is not minimal, unfortunately, but there's always, Oscar's always got things on the floor and stuff, but she always stops. She seems to, she avoids clutter very well from what I can tell, but if there's a toy or quite a big toy in the way, she will stop at it, and she might get a little bit worried what to do, maybe just for a very short time, and then she'll just clamber over it once she's sort of got her confidence up, just like about 5 seconds or less. Most of the part she seems to avoid things really well, so
but mostly, as I say, it's difficult to tell. So it's really about preempting these sorts of problems, because it's hard to assess. There are tools that assess for CVI, but these tools are designed for physically able children, and so it's very hard to. There are at this point, but actually, Gunter's still on here. Gunter has been working on developing some of these tools. So my husband Gunter is a professor of vision sciences, and he has been working on some of these tools in his lab, but they're not ready yet. So some of these would be accessible by eye gaze, but at this point in time we don't have anything that we could offer to, beyond just asking the sorts of questions that Beth was being asked. Not all of them are, or many of them are not appropriate for someone with Rett syndrome. So it's just being aware of the potential issues, but it's very hard to assess.
Right. Okay. So
but you certainly, and you were asking yesterday, I think, go see Ross Henderson in Perth. He'll give a good eye test.
Yeah, is he?
I highly recommend. Ross actually was in this lab at the same time, and he's done some work on Rett syndrome and vision. So he's the person to go see.
So is he good with people with disabilities as well then? Yeah.
Yeah. Oh yeah.
Yeah. So
yeah.
He'll
No, he's really good.
Girls with Rett are like, yeah, that's great. Yeah. Yeah, I'll maybe do that, because Emily used to be she was getting seen, and I can't remember, it wasn't in Ninewells, it was in this funny place in Dundee, so it wasn't a normal opticians either. She got referred to it, so I think it was more for children with disabilities. We had problems doing the normal test, so she was seen for quite a while. I think she's been discharged because I haven't been there for ages, but they did say she had she was slightly short-sighted. But they didn't give her glasses because they thought she wouldn't wear them, and I also thought that, because she anything on her head, hats, glasses, sunglasses, just off within seconds. But they did say if it was more of a correction, she maybe would, as you said, but maybe it's just not enough of a correction for her to do it. I don't know. But yeah, maybe she needs tested again, I was thinking.
Yeah. There's a question in here from Louise. I'm just trying to.
Yeah, I'm here.
You want to ask it, because I'm trying to read it as well. And
well, I've just put two questions. So one slightly related to what you've just been talking about. Georgia does tend to sit with her head dropped forward, almost like looking over the top of her glasses. So could that be a sign of like this lower visual problem, that she's trying to look, you know, you were saying about if you lowered the chin to be able to look above? The fact that she likes to sit with her head bent so forward, could that be a sign of that she's just doing that herself naturally? She's not mobile. She's always in a chair.
It's difficult to say. I mean, I guess the answer is possibly.
Yeah.
But lots of kids look over the top of their glasses.
Yeah.
And it's a real frustration, actually, that children tend to do this. So maybe, but
not
it
definitely.
Could just
yeah. And the other question was around, so she's been going to the hospital optometrist for 7 years now. She originally went there because the one-to-one at nursery thought she'd got CVI, and that's when she went to the optometrist. They obviously couldn't really say yes or no, but they tested her eyesight, and that's when she got glasses. But after 7 years, they're now saying they want to discharge her because they say she's just having routine eye tests now. They've told us of 2 optometrists, which I've just checked, and they are on the Seeability website. My concern is that change after 7 years and switching to somebody else.
Honestly, I wouldn't be that concerned about that.
Yeah.
If they've been recommended, if they're on the Seeability website, your experience might actually be easier in the community, because you can arrange appointment times that are convenient to you. So the practice can arrange an appointment that's at a quiet time. I mean, I don't know about you, but whenever we visit the hospital, you're waiting for an hour and a half. You're avoiding all of that.
Yeah.
If they're local optometrists that are experienced with working with people with disabilities, I would encourage you to go.
Okay, we'll do that then. I would just like to add, Georgia really giggles when they put the drops in. She finds it really funny. For some bizarre reason. She's a bit nuts.
Well, that has never happened to me. Usually my patients just hate me.
Okay, thank you. That's brilliant.
I have a colleague actually that talks about it. I have a colleague that talks about it being sparkles in the eye, and I think that's great. So if you are using drops, you could talk about getting sparkles in the eye, because that's better than it being stinging.
Thank you.
We've still got a few questions sitting. If we're happy to go on for a couple more minutes. I was just going back to the idea of decluttering, and I thought you said about even bedding and what's on the walls. So if somebody has those kind of issues with the lower vision, and the name that I can't say, simultanagnosia.
Yep.
So it makes sense to me that floors need to be clear and kind of same flooring throughout and not too much clutter. What would be the impact on having kind of lots of stuff on the walls? How does that impact somebody? And is it
so it's clutter as well?
Or?
Yeah. It's clutter as well.
So the benefit of bringing all that back would be their ability to, focus
Yes.
in general and be more balanced. So if your child's having kind of issues with seeming like they're unbalanced, could that be to do with the amount of actual just stuff in your, I mean, it's quite an overwhelming thought that
Yeah, I mean, you know, I guess it's things like if you're standing next to a cluttered wall and they're looking for mum, and I'm saying mum, and I hate that when people call me mum, but you know, if they're looking at you, Beth, and you're standing behind the walls completely white, and your child has CVI, your child will be able to see you. But if you're standing in front of your bookcase and a child has CVI and they're looking for you, they can't see you. So it's about just making the visual environment. We talk about visual hygiene, so it's just more comfortable and cleaner.
Okay.
So yes, that could be very agitating and anxiety.
Yeah, it's fascinating. I've never ever been told that before at all. Can
I just interject there though? I had, and this is a bit of a tangent really, but I had an operation on my inner ear last year, and before I had it, it affected my senses so much. So if there was too much visual stuff in the environment, sometimes I would get dizzy, feel like I was going to fall over. So I just wonder if you have the visual issue, if it's a question of thinking about everything that's going on, as in there's lots of clutter on the wall, there's clutter on the floor, there's also noise from lots of different other people, and seeing it as a whole sensory thing. Do you think that's true, Gail?
But yeah, well, you know, the brain picture that I gave you is an oversimplification, because the brain is talking to each other all the time. So all these different areas are communicating all the time, so that there can be an experience of overwhelm. I mean, I think that goes without saying. And anyone that has is a migrainer might experience that at times. You know, and then you have you have stress with the stripe patterns, and you might have stress with sounds. And if you have a degree of overexcitation in the brain, that can just be overwhelming.
We've got a question here that's hopefully quite simple, but I'm sure it's one we all want to know. How often should we have our daughter's eyes tested?
Every 2 years, unless your optometrist says sooner.
Okay. Nice simple answer, thank you. And we have, you've answered about the specialist of optometrists, which is brilliant. What's the test where you get the electrodes on the back of your head to test vision, and how do people ask for that? How do you refer for that? Can you?
There aren't very many centres that will do that. So it's called visual evoked potentials. You could possibly get it in Glasgow. You could possibly get it in Nottingham. You must be able to get it somewhere at Gosh, but it sounds like they weren't doing it for hearing. You can do it for hearing, you see. It's a very small specialty, and I think that you would be very lucky to get an appointment, and if you did get an appointment, you'd have to wait for a very long time.
But if you got into the right
appointments tend to be.
Sorry. I was just going to say, if you got into the right kind of optometrist, hopefully you wouldn't need it, would you? I mean, the thing I'm worried about is people going off and they're told that their child is sort of uncooperative, is the word that's always used, isn't it? And I mean, you've got to put your face on that thing, and sometimes things that can't.
I mean, really, the advantage of that test is the kind of definite proof. But the evidence is out there in the way that our children are behaving, in the way that they're interacting with us, in the eye contact, in the picking up something that they see, in recognising your face when they're coming off the school bus, or you meet them when they're out with carers and you're in the supermarket or in the shopping centre. Not that any of us are at the moment, or even out with carers, but you know what I'm saying. That is the evidence that you need for good sight. And that's the evidence you would get, you know, you would get hard, robust, proper evidence for the VEP, but I'm not sure it would give you anything more than you already know. Opticians and optometrists, they can correct the sight, they can prescribe glasses without knowing precisely what your vision is. They will be looking at visual behaviour in order to assess the quality of the vision. So even if they can't get a precise reading, it doesn't mean that they can't prescribe glasses, and it doesn't mean that they can't do anything for you. And by and large, in my experience, if people keep coming back, we tend to get a little bit more in every visit. So you tend to sort of start to establish a relationship with people. They start to recognise that you know, what happens in my clinic, we're not drawing blood, you know, there's nothing that they're going to be anxious about. We just have a chat, and they meet my students, we always like, and, you know, and you get a little bit more every time, and maybe you only get a tiny bit on every visit, but every visit you get a little bit more. There is a problem in England in that that's not very well funded. In Scotland, we're very lucky. So every time the optometrist wants you to come back for an extra appointment, optometrists get paid. That doesn't happen in England. And it means that, unfortunately, English optometrists aren't as keen on testing people with complex disability because they're not getting paid for it. But don't put up with that. Okay, they should be getting paid for it. You know, they should be getting paid for every visit, but they don't. And so, you know, they might not be as keen, but don't put up with that. And those that are on the Seeability website will be perfectly happy to see you.
Can I ask as well, Gail, for on the Seeability website, that's for adults with disabilities as well. And I'm thinking about those tests that I'm sure we've all seen with the fish. Did the tests change as, you know, for an adult? Do they change? Because that's not very motivating for a, well, even as you said,
no.
For me, Hannah's not interested in a fish on a card. So are there more motivating tests for older children and adults, or are they kind of standard?
No, there was a test. There was a test developed by the same team, but these tests are very expensive and very rarely used, so there was no market for it, so it came off the market. There is another test that's just basically stripes, and I have found with some people who are adults that although it's in many ways a more boring test, that they're less patronised, I suspect, by the stripes than they are by the pressure on the drain, and so sometimes that's more successful. So most optometrists will have the one with the fish because that's what they routinely use with children.
Okay. Yeah.
So no, I'm sorry. It is something I'm aware of, and it's something that we're looking into.
That's absolutely fascinating, all of that. I'm aware that we're kind of 10 minutes over time, and that we're supposed to keep within the hour. No, that's not at all your fault. We've just got lots of questions, but I think the questions that everyone has submitted have been asked. Has anybody got anything? Shona, you happy with how to move forward?
I think so. What was the thing called? Did you say that about the transitions? Because Emily we've always noticed she's got a big problem with transitions. You know, why was that again?
Oh well, I'll tell you. I'll send you a message, Shona. So that's part of cerebral visual impairment. But if you do go and see Ross, he's very familiar with that.
Great. All right, that's great. Yeah, it's just to tell the school because you know, they've noticed that when she's coming into school, and she doesn't like going through doorways, and we've always wondered why. Yeah.
I mean, it's not necessarily that, but it could be that. You know, there are other reasons why people don't do it, but the likelihood is that it's a visual problem. Okay.
Right. Okay. That's interesting. Because I've never heard of that. So.
And I mean, if you're concerned about it, it's not something that, you know, I can diagnose over Zoom.
No.
And in fact, it's not something that your optometrist should be diagnosing, even in person. And it could only be diagnosed at the hospital. Whether or not it's worth going to hospital for that, because the management strategies are the same and there's no treatment, it's questionable. But yeah. Just what it is.
It's certainly helpful in terms of keeping them more mobile. I think if I'd been more aware of that, that would have really helped us and been able to share that information.
It's useful to know that that's where it comes from, that it's not.
And also to help you avoid accidents, because Amber did a lot of stepping off curbs the tiniest bit wrong and breaking her ankles. She did it about 5 times. Just because she was so hesitant when she got to these slightly different height thresholds. And anyway, I could keep everyone on here all day referring back to different things that I've learned this morning, and I'm sure
I'm happy to answer any questions offline if there are any questions come in at some point. That's no problem at all.
That's really brilliant, Gail. And I have to add as well that I emailed you, and I think you've emailed me back today, but I haven't had a chance to see it. I'm hoping that you've said yes, you'd like to contribute to the health checklist.
Well, what I said is that
really,
get your eyes tested is all you need to do.
Well, there is that, but there's also these other elements that we've talked about this morning that are all really provide a lot more insight into why it's important, because I think a lot of the time if people see, oh, you know what, most of the time they need glasses for reading. Oh, well, pretty much people will assume sometimes that people with Rett syndrome don't read or can't read, or, you know, when actually they just got
we know that not to be the case.
Yeah. So I think we could do a whole nother bite size at some point. Beth will kill me for saying this, about literacy in Rett syndrome, and tie in the vision piece to it, and also some more communication stuff. That would be really interesting. If you have found this session helpful, please do complete the quick survey that Beth will be sending out afterwards. I have omitted to say, Gail, thank you. This has been really brilliant. And we really appreciate you giving us your time. So moving forward into May, we will be drawing on the experience and expertise of families within the Rett community for our bite-sized sessions. The first one is next Friday, and that's the parent panel discussing scoliosis and spinal surgery. And then the following week, or it's not the following week, it's the 14th of May, gastrostomies. 28th of May, reflux. And then we are going to hold, because this has been demanded by a lot of people who are dealing with these issues, one session on chest infections and respiratory problems in early June. We also have on the 12th of May a more informal session, which is the family forum, where everyone just talks randomly about different things. But we have referred back quite frequently in that session to the bite-sized sessions, because they prompt so much discussion. So everyone's welcome to that. And thank you again, Gail, for all your time this morning and sharing all that brilliant information with us, and to everyone else for coming. Have a great day, everyone.
Thank you. Thank you for having me.
Thank you.
Yeah, and tidy up your office, Gunter. No, just kidding. Bye.
Bye.
Everybody.
Bye.
Cheers.
Thank you.